Good afternoon, everybody. My name is Dyron Hamlin. I am a chemical engineer and certified industrial hygienist with GHD. And I just wanted to, share some lessons learned on dealing with ethylene oxide. We've been involved in assessing ethylene oxide human health risks for the last few years and kind of viewing it as an emerging contaminant. I know that's probably everybody's interest here. So essentially, and I'll give just some brief background on ethylene oxide for those that may not be familiar with it. It's a very commonly used chemical, for a number of different intermediate chemicals and in process chemistry. Ethylene glycols, it's used to produce ethylene glycols, and as you can see, it's used in a lot of things that we use every day. It's a known human carcinogen listed on the National Toxicology Program. It's a group 1 carcinogen, and essentially it increases the cancers of white blood cells. So you can see, the health effects associated with ethylene oxide here, hence our interest in it as an emerging contaminant. Where I've run across it also in emergency response scenarios is it's also extremely flammable. It's highly reactive. It will tend to polymerize. And if it is released and doesn't catch on fire, it's got a sweet odor at higher concentrations. It doesn't have particularly good odor warning properties. So the levels that we'll be talking about today in regards to ethylene oxide as an emerging contaminant are extremely low levels. And so it's going to be, those that really would not be, would not reach that odor threshold. So the primary routes of exposure really are inhalation, maybe to a lesser degree eye contact or skin contact release in large quantities. And just wanted to list out some of the occupational exposure levels for those that work with ethylene oxide in the workplace. The legally enforceable OSHA PELs, the time weighted average of 1 part per million over an 8-hour day. And we're gonna talk in 3 different languages today in parts per million, parts per billion, and parts per trillion. So I want you to keep an eye on those exposure thresholds. So the OSHA PEL is 1 part per million. That'd be 1,000 parts per billion or 1,000,000 parts per trillion. So kind of as we scroll through here, there is a substance-specific standard for ethylene oxide promulgated by OSHA that has a number of different requirements for workplaces to address for their workforce specifically, including things like medical surveillance, other record keeping and training associated with handling ethylene oxide. So it's certainly something that has been on the radar from a workplace perspective for some time. Worker protection recommendations include air purifying respirators up to 50, and then SCBAs, which provide a 10,000 protection factor for concentrations that might be higher in the workplace. And then some manufacturers go ahead and recommend supplied air at all times, again, because of those 4 odor warning properties. Every workplace that deals with ethylene oxide is required to have a respiratory protection program in place for its employees. So on the environment side, the EPA has ethylene oxide listed as one of their hazardous air pollutants. It is an extremely reactive chemical, which is what makes it useful in some of that process chemistry. Process safety management threshold quantity is 5,000 pounds. So anybody that handles ethylene oxide above that threshold quantity is required to comply with the process safety management standard promulgated by OSHA and the risk management plan standard promulgated by the US EPA. So from that sort of background, which has been, again, at issue for a long time, really where we have arrived over the last few years is in 2016, EPA lowered its health criteria for cancer risk based on an IRIS assessment. A report was issued in 2018, in the summer of 2018, for Willowbrook, Illinois, maybe in particular our host today. That report indicated, based on some modeled data and a 30-day sampling study, that there could be some human health concerns in the village of Willowbrook in particular. So GHD was engaged to participate as part of a task force that was formed around that particular location. And we commissioned through the Village of Willowbrook an air sampling study to augment the limited data set that had been collected by the US EPA. Essentially, the results of that air study indicated some elevated levels of ethylene oxide, both around that facility, but also in background air around the entire Village of Willowbrook. And so that has led to some deeper dives on what exactly is the background air concentration of ethylene oxide. And I really think that's the crux of where we are right now in regards to, the issue of ethylene oxide and its role as a potential chemical as an emerging contaminant. There is a good degree of ongoing litigation and some continued air sampling that's being conducted still in this area. So our objectives really were to begin to quantify, in a more rigorous and long-term and comprehensive way what those outdoor and in some cases indoor ethylene oxide concentrations were. And I'll come back to the indoor in just a little bit, but most of our effort has been focused on outdoor sampling for ethylene oxide. One of the things that we're trying to drill down on is the potential urban versus rural trends that we might see with ethylene oxide. And ultimately, obviously, a view towards providing some guidance on what is the true health risk of ethylene oxide. Some debate certainly continues in this regard. And as an example, the community in the community in Willowbrook and the communities surrounding other facilities that use ethylene oxide, and mostly from a sterilization perspective, it's used to sterilize medical equipment and other food products. The communities were extremely active, and you can see it was a very contentious situation for any community that's dealing with ethylene oxide. Other potentially interested parties like the users and manufacturers of ethylene oxide have undertaken their own proactive sampling, and as you'll see, the chemical industry and the American Chemistry Council in particular has done some additional investigation as well. Regardless of the role of ethylene oxide and its levels at the perimeters of these facilities, some very intentional work has been done around implementing additional control measures just to try to minimize the amount of ethylene oxide emissions coming from these facilities. So where does this stand in regards to what we looked at earlier from an OSHA perspective? What kind of levels are we looking at in terms of not necessarily being regulated to at this stage, but certainly ones that have been identified as potentially being of interest? So I've got 3 levels listed here that are relevant, I think, to a lot of the conversation that's going around. The US EPA's IRIS assessment in 2016 effectively lowered their health risk criteria for 1 in 10,000 or 1 in a million cancer risk as those that you can see on the slide there. So a 1 in 10,000 cancer risk at 0.01 ppb for a lifetime exposure, and a 1 in a million cancer risk for ethylene oxide of what you see there, 0.0001 ppb. That'd be 0.1 parts per trillion. So you can see we're talking about a very wide range of magnitudes in regards to what is potentially an acceptable risk. A couple of other numbers from different groups that I've got listed here. The American Chemistry Council has done their own review of toxicity data and has set a proposed health risk criteria of 0.245 ppb for the 1 in a million cancer risk. And then the TCEQ, that's the Texas Commission on Environmental Quality, has set theirs at 0.4 ppb. So what we do to try to assess basically the concentrations we measured in air relative to these proposed cancer risk values, real simple sampling methodology, in a sense, SUMA canisters, which is whole air sampling sent for GCMS analysis based on the TO15 method. Get detection limits ranging down to maybe as low as 0.02 ppb. And as you can see, if you're comparing those numbers with those risk criteria above, we reach some real challenges just in terms of detection alone. In addition, there are some potential interferences. Ethylene oxide, as I mentioned, is a reactive chemical, so there's some challenges just in regards to sample retention, sample stability, and also the potential for some of these other interference coming in during the analysis. So our objective, again, collecting ambient air samples. We've collected well over 200 ambient air samples throughout a number of different geographies, with more planned to come. And you know, some of the sort of trends that we see, again, with indoors and outdoors, again, it kind of points to this background level of ethylene oxide existing everywhere. And comparing that to some of the proposed risk criteria, I think there's going to be some real challenges around reaching those low levels, despite, you know, all the controls that we may put in place. We certainly noted that in the absence of some known sources where you know, around a sterilization facility or a producer or an otherwise user of ethylene oxide, there are other sources apparent. And if I had to lump them all into one quick category, given the short nature of this presentation, I would say that we see ethylene oxide anywhere we see human activity. So just sort of summarizing, you know, where we've been, there's also been some additional number of projects involving more than 1,000 ambient air samples. And we see a lot of the same trends, which creates obviously some unique challenges for our public health experts. How do you address these other sources that are difficult to control that just result from essentially human activity? The method detection limit is above the EPA risk criteria for the 1 in a million cancer risk. And with these other interferences, et cetera, there's ongoing efforts to improve laboratory methodology. But at the end of the day, you know, what can we conclude is the quote safe level of ethylene oxide? And just by way of sort of setting some background, this is from the American Chemistry Council. These are from 4 locations, just again, geographically kind of scattered based on data that's recently been collected. And there you can see the levels reported in parts per trillion, and around
3 minutes.
Okay, 0.1, 0.2 parts per billion, or, you know, 100 to 200 parts per trillion. And that, as it relates to the cancer risk of 1 in a million of 0.1 parts per trillion, obviously there's going to be some difficulties reaching that. So where are we headed with this? You know, a lot of these sterilization facilities have either ceased operations for implementing new control measures, or they've decided to relocate based on that pressure from the public and making business decisions to relocate. Again, there's continued debate regarding the health risks and what are those appropriate risk values. And with new monitoring technologies that are coming to bear in regards to real-time monitoring capabilities with low detection limits, we do see some opportunity for further studies on what are those sources and drilling down. You know, is there a way that we can, you know, down the road look to regulate or better control some of those potential sources? Again, characterizing the ambient levels, but also looking back to what those indoor levels might be of interest. So that's kind of a quick brief on, you know, ethylene oxide, where it stands. There's certainly a lot more work going on with this. We've done a lot of studies, and we envision a lot more to come and a lot more debate on this topic. I'd be happy to answer any questions you might have at this time.
Yeah, we have about a minute for questions. Thanks very much, Darren. Janice, do we have any questions?
So far, we just had a comment. Let me check Puva, and then I can come back to the comment. Nothing there. Okay. Yes, persistence is an important factor, but should not be sufficient alone in the absence of other factors like exposure, toxicity, bioavailability in the context of use, and so forth. There are many materials which are persistent yet benign. Other materials like fluoropolymers are persistent, but that is attributable to the is it carbon fluoride bond? I'm not a chemist, and it makes it possible to make products of high societal value. If you had a response.
It sounds like that may be a little more relative to the PFAS, but on that note, I will say there's even been debate around the persistence of ethylene oxide. There's studies that show that it remains atmospheric, their atmospheric half-life is 68 days, and some that show it's on the order of hours. And a lot of that depends on the environment into which it's released, or how reactive. Again, there's my contact info. So to echo your comment earlier, Sarah, any questions, feel free to reach out.